This is Janelle Yates, Senior Editor of OBG Management. In January 2015, Healthy Women and the National Association of Nurse Practitioners in Women's Health released the findings of a new survey on provider and patient attitudes toward cervical cancer screening. Cervical Cancer Today, a national survey of attitudes and behaviors, was conducted jointly by the two organizations among more than 2,000 women and 750 healthcare providers nationwide. The survey found significant confusion among both providers and patients about the optimal screening interval. In addition, 91% of providers believe the Pap test should remain part of frontline cervical cancer screening for the foreseeable future, and 90% of women believe the Pap test is vital to their health care. Among OBGYNs and nurse practitioners, 83% said the HPV test adds value to cervical cancer screening. 74% of healthcare providers believe that both the Pap and the HPV test are valuable to their patients, compared with either test alone. Most healthcare providers prefer to see their patients every 1 to 3 years for cervical cancer screening, and 76% of women agree with this timing. More than half of OBGYNs and nurse practitioners feel that extending the screening interval to every 3 to 5 years will have a negative impact on women's health. In addition, only 48% of women understood that HPV can cause cervical cancer. Only 15% knew that HPV infection can resolve on its own, and 41% of women reported an increased level of anxiety in response to a diagnosis of HPV infection. At a briefing about the survey findings, Dr. James Simon offered important context, which he elaborates on in this podcast. Dr. Simon is clinical professor of obstetrics and gynecology at George Washington University and medical director of women's health and research consultants in Washington, D.C. He serves on the OBG Management Board of Editors. Dr. Simon, why did you choose to speak on this issue at the briefing?
Well, as a practitioner committed to women's health and women's health research, I was taken by the results of the survey, and as a gynecologist, I'm faced with the issues that were highlighted by the survey every day. So this is a practical as well as women's health issue that I thought needed a strong voice.
Why do you think there's confusion around cervical cancer screening among both patients and providers?
Well, the question is actually fairly complicated, but let me give you an oversimplified answer. I think on the one hand, we've convinced women that they needed an annual Pap smear, at least for the last 40 to 50 years. And that annual Pap smear came to be confused with an annual gynecological exam. So that when new guidelines, and the other reason for confusion is there were several different ones and they seemed to be changing nearly daily, and further, they didn't all agree one with the other. When those new guidelines were put forward, patients got mixed messages. They got mixed messages because they no longer needed a Pap smear every year, which to them meant they didn't need an annual gynecological exam, which probably is not true. And further, they would get one set of guideline information from maybe their primary care provider and a different guideline piece of information from their gynecologist, and all that against the background that they don't need an exam. So it was logical that women got confused, and practitioners equally so.
How often do you screen patients for cervical cancer, and what tests do you use?
So we're fairly consistent with the 2012 screening guidelines, and those screening guidelines basically say no pap smears in women under the age of 21. Women 21 to 29 should get a pap smear at least every 3 years, unless there's some reason to suggest an infection or a recent exposure, or those women have unusual circumstances. For example, I happen to take care of a number of women who are HIV positive, a number of women who have underlying autoimmune diseases, those two examples being patients with altered immune systems. And I also take care of a significant number of women who are professional sex workers. And they may have totally different rates of exposure to both HIV and HPV related infections. So for that other group, we frequently screen them annually, but 21 to 29 every 3 years. And then the women 30 to 65, they too would get pap tests every 3 years, or they could actually go to every 5 years if an HPV test was also done at the same time and it was negative.
How do you counsel patients as to the significance of HPV infection and the meaning of both HPV and pap tests?
So fortunately, I have a relatively well-educated patient population, but we talk about sexually transmitted infections of all kinds beginning at that woman's first visit. We talk about them in terms of getting vaccinated, hopefully before sexual debut, but after, if they're negative, their pap smears are negative. We talk about it in the context of sexually transmitted infections that might affect their future fertility and or tubal disease. And finally, we talk about it from a public health point of view, about the need to prevent the passage of HPV and sexually transmitted diseases to new partners so that they understand the importance of condoms and safe sex, both to protect themselves and also to protect their partners.
Is your counseling likely to change at all in light of the survey findings?
You know, I don't believe that my counseling will change in light of the survey findings, but I hope the survey findings will improve counseling by others and focus counseling by others to be more consistent with the guidelines and the findings of the survey. I know that both the survey findings and my own experience is that there's a big absence of counseling in this and many other areas of women's health because time is such a precious commodity, and the well woman visit is now charged with talking about and counseling about many problems, not only HPV and cervical cancer and its risk factors.
Is there anything else you want to say on this topic?
I think the single most important issue here is that we need to counsel patients of all ages that a gynecological exam, along with a general physical exam, is an important part of health maintenance. And what is included, it goes far beyond the Papa Nicolau smear or a Pap smear with or without HPV testing. And that is really the important finding here, and also the important teaching that I'd like to see go forward. Unfortunately, the various and sundry stakeholders have been unclear or non-directive to women in this regard. We need to make sure that we uncouple the annual well-woman visit from the Pap test, but not to say farewell to the annual woman visit simply because we're not doing a Pap test every year.
Thank you, Dr. Simon.